So I'm going to
All right.
just introduce you to Christian Bolivar really quick, and I'm going to have him introduce a little bit about him. And then we'll get started on the interview and ask the questions that you guys have sent me.
Hi, everyone. My name is Christian Bolivar. I just want to say right away, I am not a doctor. I'm not a chiropractor, but I have worked alongside chiropractors for the last 3 years now. Right now, I'm a care manager for a chiropractor, and the journey really started with my own healing. I suffered from headaches and migraines that lasted up to 3 to 5 days sometimes. I didn't know why. And I sought, or actually, I didn't know a chiropractor could help me with that, but luckily I was able to learn about chiropractic from an event that I went to that had nothing to do with chiropractic. And I'm so happy that I was educated that day because it has completely changed my life. So much so that I love educating people on chiropractic care, and that's my main job today.
Awesome. Well, we're really glad to have you, and we're really glad, too, that you're here to answer questions and share your knowledge with us.
Yeah, thanks for having me.
So for chiropractic, it deals a lot with the nervous system. Can you kind of just explain how chiropractic works and how it can help alleviate pain off the nerves?
Sure. So the chiropractic adjustment is what they're doing. What a chiropractor does with an adjustment is taking the pressure off of the nerves, because the nervous system is the master system that controls absolutely everything in your body. And throughout time, as we sit on our computers hunched over, or we look down at our phones, we start changing our posture. Our muscles start to get used to being in that position, and it throws the vertebrae out of alignment. So a chiropractic adjustment takes that pressure off of the nerves so that everything can run smoothly and your brain is able to communicate with your body at 100%. Versus, it's like stepping on a hose, right? You step on a hose and some water still comes out, but it doesn't come out as well as it should. So taking that pressure off really helps everything flow better.
It makes sense, especially since, like, with fibromyalgia, it seems like a lot of really congestive nerves. They characterize it right now as overactive nerves until they can find the set diagnosis. Have you seen chiropractors adjust fibro patients in clinics or anything like that, or even talk to them?
Yeah, I have actually. And what I've learned about fibromyalgia is that, we don't really know a whole lot about fibromyalgia. We know it's a nervous system issue, and chiropractic adjustments help the brain or the nerves really deal with pain better, because someone with fibromyalgia perceives pain differently. And it has something to do with the nerves not firing correctly. So again, a chiropractic adjustment, taking the pressure off the nerves, kind of helps to reset your nervous system, and it helps get rid of a lot of the pain that fibro sufferers have.
Yeah, it's a hard word to say.
It is fibromyalgia.
It took me weeks to literally be able to say it correctly, and spelling it's a whole different story. I still have trouble spelling it sometimes.
Yeah.
So one of the biggest questions that I got in one of our fibromyalgia groups on Facebook is what it feels like and if it's painful.
So chiropractic adjustments are not painful. They are gentle manipulations. Chiropractic actually means to be done by hand. So a chiropractic adjustment really takes the pressure off the nerves, which is it gives you a sense of relief afterwards. And for your first time, a chiropractor would only give you 1 or 2 manipulations because they don't want to overwhelm your nervous system. So for a short answer, no, it doesn't hurt. It feels really good afterwards.
From your experiences on getting adjusted, how has it helped you personally?
Okay. So I used to suffer from headaches and migraines, really bad headaches and migraines. And it's because I edit video. So I do it on my laptop. And there's no good way to be on a laptop, right? It's always below eye level, and you gotta have to be hunched over. And I did that for years, not knowing the damage I was causing my neck. And so I learned about chiropractic care. I went and got Xrays, and I learned that my neck my head was really far forward, which is not normal, and it was putting a lot of pressure on these nerves in my neck, specifically the first vertebrae, called the atlas, which controls the blood supply to your brain. And pressure on those nerves can cause a lot of headaches, migraines, dizziness, insomnia, anxiety, things like that. And I had headaches even when I wasn't on my laptop. So I really needed answers. And after 3 months of not just doing adjustments, but doing therapies for my neck muscles to bring them back, really it helped get rid of my headaches completely. My migraines and headaches went away after just 3 weeks, but I really had to stick with the program for 3 months to make sure that they didn't come back, right? Because if I just quit after 3 weeks when the pain went away, it would have inevitably just came back.
That makes sense. Headaches and migraines are two extremely common symptoms too with fibro. We have the weirdest symptoms too. And I remember I was looking at the nerve chart we got when we worked together. I actually found it the other day, and I'm looking at it and I'm like comparing the list of 251 symptoms that are recorded for us with the chiropractic chart. And I had no idea that some of them, like some of the adjustments would even help with symptoms like IBS, body aches, obviously. But like in certain places, like elbow pain, it's really like I hit my elbow the other day, went and got adjusted, and I'm not even kidding, within minutes, literally the pain in my elbow went away because it literally hurt for like 3 to 5 days.
Wow. That's a long time to be hurt.
Yeah.
Hey, when were you diagnosed with fibro?
I was diagnosed when I was 20. Yeah, 20, but they think I've had it since I was about 12 or 13, which is rare. So
Wow.
They're thinking on how it was caused, or at least the newest theory on what causes fibro is trauma to the body, whether it's psychological or physical. So I had mono for about 9 to 10 months, and I tested positive that entire time for mono. And the body aches literally just never went away. So
Wow.
I figured that I just had mono like my whole life. And then a doctor finally told me, no, it's not mono. I'm like, okay, what is this thing? So yeah, a year and a half of testing, and they figured it out.
Better late than never, I guess.
Yeah, exactly. Especially like,
Another good reason why it's good for not just people with fibro, but anyone, is because it's all natural and there's no drugs involved. And we all know the side effects of any drugs that you might take, right? If you were taking a lot of medication just to help get rid of the pain of fibro, you would have a lot of other symptoms then, because the drugs might, block the pain, but then they're causing other issues. With chiropractic adjustments, you don't have those side effects. You're just resetting the nervous system, and your body feels better, just a few minutes after the adjustments.
That's cool. I like that. I know that's what I experienced, at least after my adjustments too. Literally, like, my neck is always my worst spot, and my chiropractor always is like, your neck is horrible. What do you keep doing? I'm like, I don't know, trampolines.
Yeah.
He literally adjusts it, and I'm like, hey, the migraine's gone. I've had this for 3 days. Because I landed wrong on a trampoline.
I would love to say to people, don't be afraid of being adjusted, especially if you've heard, someone have a bad experience with a chiropractor. What I always tell people is, if you had a bad experience with a dentist, you would just find another dentist, right? You wouldn't give up on dentistry forever, right? It doesn't make sense. chiropractors are doctors, and they study the human body, they study nutrition, they study everything about the body, and they're well trained. They're not there to hurt you, they're there to help you. They can offer you nutrition advice, like I said, and they can also help you with joint mobility by helping you do different types of therapies, either at home or there at the clinic. So it's been a life changer for me and a lot of people that I know. And I know that fear holds a lot of people back. And if you were held back by fear forever, then you would never get to experience the amazing benefits of chiropractic care.
Exactly. And that brings up actually one more question that I have, just from, we had someone comments, I forget what social media site it was, but that she had a horrible experience with a chiropractor, and that the chiropractor didn't do Xrays. And she had asked me how to find like good characteristics of a chiropractor, and should a chiropractor always do Xrays?
I'm glad that you brought that up, because that's so important. If a chiropractor does not take X-rays first, just run. Okay, do not trust that doctor, because they can do further damage, and I'm sure that's exactly what happened with that person.
Yep.
Because the chiropractor wasn't able to see if there were any fractures in the bones, if there was any. You have to see the X-rays to know how to manipulate the body. Period. If you don't have the X-rays, then you're just doing it blindly, and that's never a good idea. I don't think we realize how much damage we actually do to our body every day, just simply by looking down at our phones like this, right? Because it's micro trauma, and what that means is that it's something that's affecting you little by little every day, and you don't really feel the effects until the damage is done, and now you're in a lot of pain.
Yeah.
So I think that being aware of your posture is huge, and a chiropractor is going to help you figure that out, because again, they're doctors and they studied this, right? So sometimes it's as simple as like strengthening, some back muscles, or different parts of your body that are going to help you function better, walk better, all the ways that your body moves throughout the day. They're gonna help you improve the way you move through life. So it's been such a life changer for me, and I really hope that more people try it, because they don't know what they're missing out on.
Awesome. Well, thank you, Christian. I really appreciate your time and you explaining chiropractic. That way we can try to get everybody in chiropractic, because I'll die on my grave saying the chiropractic's the only way I can survive fibro.
Yeah, and I'm so glad that you discovered chiropractic when you did, because I know your life would be much different without it.
Oh, big time. I'd have a lot more headaches. It wouldn't be fun. And a lot more body
with
pain.
All the heavy lifting that you do.
I know that too. Yeah, there's a video.
Fibromyalgia, heavy lifting. Come on.
I remember the one day my trainer had pointed out to me that he could literally see how out of line my hips were when I squatted. And I was like, well, that explains like the pain on my one side. And he's like, why didn't you mention the pain to begin with? I'm like, oh, I just thought it was because we upped the weight. He's like, no, you're an idiot. Go to the chiropractor. You're done for the day. Go walk on the treadmill. You're not doing any more lifting. It's like, dang it. Got adjusted and it's fine.
Good thing you have smart people around you.
Yes. Or at least ones that'll pay attention to my bone structure.
Yes, and that's huge too. I mean, you are really doing it right, having somebody there watching you, because there are things that we don't see sometimes, and our body starts to compensate, and that's the worst, and you know this.
Oh yeah.
When you're lifting heavy and your body starts to compensate using other muscles that it shouldn't be using, and shifting its weight, and we do it subconsciously because our body wants to take the easy route. It's easier, but it's taking a toll on your body. And if you can't do the lift with proper form, then you shouldn't be doing it. You should, you should be decreasing the weight. And that's have somebody watching you to make sure that you're doing it right.
All right. So thank you. I really appreciate your time. Tomorrow we're actually going to talk about massage and fibro. So I'm really excited for that.
Nice.
to partner that too with chiropractic. So thank you, Christian. I really appreciate your help.